We all have a state of mental health and wellness, the same way we all have a state of physical health and wellness. At times, our mental health may be close to optimal. During these times, we typically feel emotionally stable and levels of stress in our lives feel manageable. At other times, our state of mental health will be impacted significantly. For example, by factors in our life, such as relationship stress, work demands, worries about money, or physical health concerns. Our mental health is an important part of our overall health.
Mental health is a state of being. In fact, it is a state of well-being. It's about feeling good about who you are, having balance in your life, and managing life's highs and lows. We all have a state of mental health whether or not we have a mental illness. Mental illnesses are disorders that affect the way we think, feel, and act. Positive mental health is a combination of feeling good and functioning well in life. A person can be flourishing in their mental health, or they may be languishing. Even someone who has mental illness can still experience positive mental health. And someone can have poor mental health and not have a mental illness. However, they can be connected. Poor mental health can increase your chances of developing a mental illness. And this affects many people. In fact, every single year, about 1 in 5 people will develop a mental health problem or illness. And despite the prevalence, misconceptions still remain about mental illness.
Many people don't believe that mental illnesses are real illnesses, like heart disease or cancer. Some might say to a person with a mental health problem, "You're fine, at least you have your health." Or they might even accuse them of making it up. Unlike a broken leg or cancer, which often have visible symptoms and can be detected with objective tests, mental illnesses are often invisible. This inability to see what's wrong may add to the public perception and even fear of mental illness. But, like heart disease or cancer, mental illnesses are bona fide medical conditions. They involve complex physiological processes, as well as changes or imbalances in brain chemistry. Mental illnesses are real illnesses. It's a common misconception that mental illness is a permanent, untreatable condition, and that people with mental health problems can't fully recover or return to a high level of functioning. Not only do people with mental health issues get better, but many recover completely. They are able to live, work, learn, and participate fully in their communities. Even individuals who experience mental illnesses that last for a long time can learn how to manage their symptoms so that they can get back to living their usual life. There are more treatments, services, and community support systems than ever before, and they are effective.